All lines are going to be kept on mute by our host, just to minimize as much as we can the background noise. And then toward the end, when we open up the question and answer period, just know that you'll have the opportunity to unmute yourself. As far as questions are concerned, please, for those on their computers, please plan on using the chat box to enter your question. We'll capture those questions if they occur during the webinar and try and respond to them as best we can. If not, we will get to them in the question and answer portion. And when we reach that time, if you haven't already, go ahead and simply say, I have a question, and we can unmute your line if you'd like to ask it verbally, or if you'd like to type your entire question in the chat box, you'll have that option as well. And for those people on the phone, we will take the questions in the chat box or from those raising their hand in the chat box first. Then we will announce we'll be taking questions from the phone, and people will have the opportunity to unmute themselves and ask their questions. We will be asking for a little bit of understanding, especially if several people unmute themselves at the same time and trying to ask a question at the same time. So we will all get through this together, I'm sure. At the end of the webinar, you will be sent an evaluation. We value the feedback so that we can continue to provide good service. So please fill that out when that comes to you. Next slide, Sarah. So we'll be doing just a brief introduction today, letting you know a little bit about the National Indian Health Board. Then we will do an overview of this particular funding opportunity. And then we're going to do an application walkthrough. That application walkthrough will be what's required of you in advance in order to apply. Then what do you need to create originally to submit as part of your application, and what are the forms that are necessary and already required and maybe already online that you'll need to complete. We will leave it plenty of time at the end of the call for question and answers. Next slide, sir. So the National Indian Health Board is a national tribal organization. We're founded by the tribes, and we work and serve the tribes. We were established in 1972, and at the very core of our mission statement, which is on your screen now, is advocacy. And so to that end, we seek to secure and provide resources to the tribes so that tribes can operate their own health systems and public health operations, functions, and activities with the resources, capability, and capacity that they need to act upon their sovereignty. Right? So this particular webinar is being operated out of our Public Health Policy and Programs Department as an effort to ensure that tribes have access to these resources in a much needed time. Next slide. To help ease the access to those resources, NIHB has created a COVID-19 Tribal Resource Center. This is located on NIHB.org, and there are 2 links right on our homepage that will take you to this Tribal Resource Center. You really cannot miss it. If you can't find it, it's located on the top of the screen from NIHB.org, or the direct link, NIHB.org/COVID-19/ is the actual homepage. On the Resource Center, you're going to find a lot of information, all directly related to COVID-19. In relation to funding, you'll see in the left-hand navigation toolbar, there's a funding opportunities menu, and you can click on that, and that's going to take you to information on all of the federal funding opportunities that we are currently tracking, and provide links and information on opportunities from the Environmental Protection Agency, from the CDC, from IHS, from SAMHSA, a variety of different funding sources. You will also find some community health tools that are all online for download, for dissemination, for copying, for customization on a variety of different topics, ranging from COVID-19 and stigma, to homelessness, to housing security, to food insecurity, to psychological impacts, to sleep. So there's over 30 community health tools currently online. We're also capturing a lot of notes and communiques from the federal government and storing them all here. Our hope is that our COVID-19 Tribal Resource Center can serve as a one-stop shop for tribes as they are mounting their own response to this pandemic locally. It's also important to note that as part of our tribal data project, we are collecting as much data as we possibly can on COVID-19 and its impact on tribal communities. And so we have an interactive data visualization that you can use, and you can take it down to the county level. Unfortunately, we do not have tribal specific data, but you can actually begin to look and have a map of the country and see where COVID-19 is. And you can interact with that map, look at different countries based upon the population of American Indians and Alaska Natives. And you can also highlight different statistics, including diagnosis, testing, and mortality. So that's a wonderful resource that's available to tribes all through the Tribal Resource Center. We've created, again, on that funding opportunities page on our Resource Center, the link is on your screen now, some specific information. There is a fact sheet on this CDC request for funding or notice of funding opportunity, or NOFO. There is a PDF document of a walkthrough on how you would apply and could apply, and the application elements for this particular NOFO. There's a quick refresher on SMART objectives if you feel like you need to remind yourself what SMART stands for. There's a tip sheet for writing activities and outcomes. That's just a real quick one-pager if you need help when you're working on this work plan template, coming up with some activities and activity language. That's there. I would also like to note that we are recording this webinar. This recording will be posted also on this funding opportunities page. And in addition, on May 26th, from 3 p.m. to 4:30 p.m. Eastern Time, NIHB will be hosting open office hours for this particular CDC funding opportunity announcement. And that will be an open time for anybody to call in, to have discussion, to ask questions, to seek specific guidance on your tribe or tribal organization's application for these funds. We're not at this point anticipating much didactic presentation, but simply open discussion, question and answer, and immediate technical assistance. And that is May 26th, that's the last week, 5 days before the deadline for this NOFO. So if there's any last minute issues or glitches or confusion that people are having, we hope to be able to be available to answer any of those questions. At this time, I'm going to turn it over to my colleague at NIHB, Sarah Price, to do an overview of this particular NOFO.
Thank you, Robert. So this is just meant to serve as a brief overview of how this opportunity will be organized and funded. Definitely not meant to replace the really great materials coming out of CDC or any of their information that they're sharing. But so this is a non-competitive funding opportunity from the Centers for Disease Control and Prevention. It's designed for all federally recognized tribes, tribal organizations, consortia of federally recognized tribes, or their bona fide agents. So this means that if you meet any of these categories, you should be applying for this funds. We know there was some confusion early on with different components of this, but all tribes, tribal organizations, consortia, and their agents should be applying for this funding opportunity. This will also allow you to be eligible for additional funds that might be coming through this opportunity. So please consider applying before the deadline. There's two different components, as I said. There's component A, which is all Title I and Title V tribes and tribal organizations. And then there's also component B. So this is all tribes and tribal organizations, including those in component A. For component A, those Title I and Title V, within 10 days of applying for this, you will receive $25,000 in funding, in addition to funds based on your IHS fractionated allotment. This is just the first round of funding. This is just the floor of what you can receive. Additionally, in June, there will be a second notice of award, and this award will be additional funds for a percentage based on the ratio of your population served based on how many populations are served overall. So basically, CDC is working to get you funding as quickly as possible. So that's that first notice of award. And then once they know how many people have applied to this opportunity, they will be able to give out additional funding. For component B, you'll also receive a base funding of $25,000 within 10 days of application. And you also will receive additional funds in June. However, you won't be receiving the additional funds based on your IHS fractionated allotment 10 days after applying for this. So Again, there was some confusion over who should be applying. Whether you're a component A or component B, you should be applying for this funding. You will be receiving funding within 10 days of the application, as well as additional funds in June. In addition to the efforts that you're going to be undertaking going forward, you also can apply to have funds reimbursed for anything that was spent after January 20th, 2020 for COVID efforts. So if you've already spent funding on this, please apply to have that reimbursed, and CDC will be giving funding for that. You also, as I said, should be applying for this for any future funding that's allotted through this announcement. If you don't apply for this, you may not be eligible for that future funding. So please try to go and get your applications in for this on time. The areas of work for this are pretty broad. CDC's goal was to make it so any COVID-19 mitigation strategies could be included, but they include emergency operations and coordination, health information technology, surveillance and epidemiology, laboratory capacity, communications, countermeasures and mitigation, recovery activities, and then the catch-all, other preparedness and response activities related to COVID-19. If you have any specific questions about if your work does fit under this, you can reach out to CDC. They have emails on the website. They have an FAQ where frequently asked questions about what is allowable under this funding are answered. And you can also reach out to us if you do have questions, and we can see if we've already heard from them about that specific topic. This application is a bit different than other applications that CDC's put out in the past, namely that this is non-competitive funding. So everybody that applies that is eligible for the funding and has a complete application will be funded, and the amount of funding will depend on how many people apply. They also have worked to make this opportunity more streamlined than normal. So this means that applications are funded on a rolling basis. This means that you can apply at any time. You don't need to wait till the deadline. You will not be getting funding after the deadline. You'll be getting it within 10 days of application. So there's no reason to wait. There's fewer application documents than normal. We recommend you use a checklist, which I'll go over in a few moments, in addition to the RFA, because some of the things outlined in the RFA that are included in the standard application may not actually be required for this specific opportunity. In addition, a template for the project work plan will serve as your project narrative. In the RFA, it does outline a more detailed project narrative that is more normal for a CDC application, but in an effort to get this funding out quickly, you do not need to do what's considered a normal project narrative, and Robert will go into that a bit more as we go through the walkthrough. And then there's only one application for both components, that's A and B, so all tribes can apply for just this one opportunity rather than having to apply for separate opportunities. One thing that we recommend using is CDC's checklist for what is required for this. So the checklist is a little easier to understand than the RFA for what documentation specifically needs to be included. I have it right here. These are all the documents that need to be included in the application. And then they also talk about what doesn't need to be included, many documents of which are normally included in CDC applications. So definitely recommend using their checklist in addition to the RFA, and not just relying on the wording in the RFA, since some of the wording does talk about what's required for a standard CDC application. Okay, with that, I'm going to turn it back over to you, Robert.
Okay, thank you very much, Sarah. And I'm seeing some questions already coming in on the chat box. Just know that we will capture those, and we will respond to those during the question and answer period. Okay, so before I start walking through this actual application step by step, I want to be sure that everybody on the call knows that we are not speaking as representatives of the CDC nor of the IHS. NIHB does receive funding from CDC, and we do have some funding to support some COVID-19 response activities. However, today we are framing this discussion and this walkthrough as if we were going to be applying for this particular funding opportunity. It should be said that NIHB is not eligible, and therefore we will not be applying for this, but we figured that that was the easiest way to be able to present clear and concise information to you. So we're going to be speaking as if we were applying for this and providing some tips in that vein. Next slide. We've structured this walkthrough in 3 different steps, and all 3 steps are required to submit a successful application. And so we're going to talk about step 1, registration, step 2, project information and activities, and then step 3, we're going to be walking through each of the required forms that are needed to submit. The forms are actually online at grants.gov, and some of the forms you'll need to find, print, sign, and then upload yourself as a PDF. So just know that that's kind of how we're going to be structuring this and walking through each one of these. Sarah, can you advance 2 slides, please? All right, step 1, registration. Now, doing our due diligence to cover this. In all honesty, I imagine that all tribes and tribal organizations have already done these steps, or else they would not have already been eligible or competed or received federal grant dollars already. So, but just to make sure that everybody knows, you need to, of course, register the tribe or organization within the DUNS system to receive a data universal numbering system, a DUNS number. You can do that through the phone number that's on the screen right now, or you can, of course, go to fedgov.dnb, which stands for DunsandBradstreet.com, and fill out and apply online. Now, if you are, you're poking around and you're talking to your finance people or talking to your administration and realize you do not have a DUNS number, then please do apply as soon as you can. That can take a while to get. But again, I'm speaking with a fair amount of certainty that the majority of people on this phone do have a DUNS number already. Next slide. You will also need to make sure that your tribe or the organization is registered within SAM, or the System for Award Management. This is a federally managed website that all entities that receive federal funds must register through. So there have been a number of different websites over the years that have been used to help monitor and manage federal funds, and within the last 5 years, they've been consolidated now into a single website, a single system called SAM. So this is much like what I just stated around the DUNS number. I imagine that everybody is already registered within SAM, or else you would not be receiving federal funding. But you do need to do your due diligence and make sure that you are registered within SAM. Next slide. And then, of course, grants.gov. Grants.gov is the web platform that CDC is using to receive the application for this particular NOFO. So you need to make sure that you have a viable grants.gov account, and the accounts are established by tribe or organization, and there are different logins that can be affiliated, or different sub-accounts that can be affiliated for that tribe or organization within the grants.gov system, but you do need to make sure that you have access to the grants.gov account for the tribal organization. Anybody can go in and create themselves a login, that's fine, but you need to make sure that you're affiliated with the tribal organization, or else the actual application will not be submitted as a tribe or a tribal organization. It's also important, if you haven't already, this is where you can obtain all the latest and official guidance on the particular grant. So you need to log in, type in the formal NOFO number, which is CDC RFA OT20-2004, and that will bring you to this particular NOFO's home site, where you can access all of the information that's been published, including any amendments, frequently asked questions. Anything that CDC has published on this particular announcement will be housed in grants.gov. It's also really important that you create a workspace. And so grants.gov within the last 2 years has changed some of the way they work. They apply now by workspace. This is a common space so that multiple people within your tribal organization can work on the same application at the same time. So there are some benefits to having this workspace. But in order to create yourself a workspace, you need to log in, again, under the tribal organization, and click the apply button, right? And that's going to open up and create yourself a workspace. That's also where you're going to see a listing of all the online forms that you'll need to complete and you can do so right there in the workspace. You can save the progress, you can exit, and you can come back at any time. Some real quick tips on working on the grants.gov workspace. Grants.gov is, of course, password protected. Keep your password handy, right? That's going to be extremely important because you need to log in every single time. Most computers and browsers do not save the grants.gov password. So you can't simply just go in, enter your login, and have it log you in automatically with a saved password. So you need to make sure you have that password with you at all times. Also, it's important to note that you can lock and unlock any one of those forms in there. So if in your grants.gov account, your login has administrative privileges, and you've already, uploaded a budget, for example, and maybe you don't want that information privy to anybody else working on the account or working on the application, you can lock that particular form so that nobody can either access it or change it. Also, if multiple people are working on the workspace at a single time, it is important, and this is just a tip to track what's been uploaded, what's been completed, and on what day and by whom. Speaking from experience, when you have multiple people working on an application, somebody may think they're uploading the most recent version of a particular form, and then somebody else comes around and uploads a different version. And so make sure you're tracking your assignments and who has access to which forms and who's responsible for uploading which forms. I will say the workspace can be quite helpful and quite useful. And it's also a great way to get things done more quickly with multiple people working on it at the same time. If you have any questions about working on grants.gov, feel free to submit them in the chat box, and we can work through some of those later. But I do want to spend most of our time talking about the project narrative and the other elements. So next slide, Sarah. Sarah already mentioned that the CDC has streamlined this particular NOFO. And we have heard at NIHB that there are still some confusing elements. Hopefully we'll try to clear some of those up. But one of the most important parts is the project narrative only requires 2 elements. So in a normal application, in a regular application, when the world is not existing in our current state of insanity, then you'll see, you'll have to provide an organizational capacity statement that's a narrative. You'll have to talk about staffing plans. You'll have to talk about evaluation plans. You'll have to talk about project management. You'll have to talk about data management. You're gonna have to do a lot more, and it's all gonna be written, and you'll have a 10 or 12 page limit. That is not the case with this particular NOFO, right? The CDC has pared it down to 2 simple elements, all right? It is the organizational capacity statement and a work plan, okay? These are the only 2 things that will comprise your project narrative. Next slide. The organizational capacity statement. Under these 3 particular bullets, list acceptable documentation that the tribe or tribal org can submit to satisfy this required element, right? They're not asking for a written narrative, if you will, description of the capacity of the tribe or the tribal organization. That's what we write in a normal grant application. That is not what's being asked for now. You can submit a letter that's signed by an elected tribal leader or anybody that they may designate, as long as it's on official letterhead, speaking to and attesting to the existing capacity and capability of the tribe or tribal organization to fulfill all of the activities that are proposed in the work plan. Right? This does not need to be a long or drawn out letter. It could simply cite the fact that the tribe has experienced communicating with their tribal members in times of emergency. They have experience conducting public health activities, and they have access to the staffing, the space, the facilities, and the resources needed to be successful in implementing the work plan. right? It doesn't need to be a long, drawn out description of what that capacity is. It simply needs to test the fact that the capacity exists. You can also submit, and this is also, you don't have to submit all three of these, but you could submit an organizational document for the element, the department, or branch of the tribe or tribal organization that is going to be responsible for implementing the activities in the work plan. So if you have an organization, an org chart, or some kind of staffing chart for the people that will be implementing these activities, you could submit that. Also, if you have an organizational chart or something that's been created as part of an emergency response plan or incident management plan, specific to COVID-19, that's also an acceptable document for your organizational capacity statement. If you have resumes or position descriptions for any vacant positions or positions that are already filled under that plan, that can be submitted as well. So the point is, you simply choose one of these, and that is what you're going to upload as your organizational capacity statement. Within grants.gov, this will get uploaded, and I'm actually going to open grants.gov. Oh, I've been kicked out. So I will open a grants.gov just a little bit later to make sure that everybody knows exactly where this needs to be uploaded within the grants.gov system. Okay, so I will log into grants.gov in just a little bit so that I can make sure that I point everybody to the exact place. And here's another little tip for everybody in managing their own applications. If you are logged out of grants.gov, either by the system or yourself, and you need to go back in and work on your application within your workspace, sometimes it can be hard to get back to that place. So you simply need to log back in, and then in the left-hand sidebar, there's going to be a place that says Manage Workspaces. Click on Manage Workspace, and then it may bring it up for you at the bottom of the screen, and you can click on and access your workspace, or you may actually have to conduct a search for your workspace. I find that just using the CDC RFA OT20-2004 and search for that, and it'll bring that back up. So just know that you need to manage the workspace, search back for it, and then it'll bring you back to the workspace that you created. And your organizational capacity statement will be uploaded under the project narrative form on grants.gov. All right, and clicking on that simply opens up a screen that allows you to add attachments, and you can add multiple attachments. All right, so you can add one under the mandatory project narrative file. It can be either one. It can be your work plan, or that can be your organizational capacity statement. It doesn't make a difference. And then under optional project narrative file, you can add additional narrative files. It says optional, but know that all of the attachments get submitted as part of your application. And so try not to pay too much attention to the mandatory or optional narrative file elements. Just click on project narrative file and upload all your attachments in that screen. Okay, next slide, sir. The work plan. So CDC has created a template for creating your work plan. It should be said the work plan should be, the template's in Excel, and you should fill it out in Excel, and you should leave it in Excel when you upload. We heard on the CDC call last week that they held that it's okay to upload an Excel file. All right, so plan on filling it out in Excel and uploading it in Excel. And in response to a question we saw in the chat box, you're also going to upload your work plan file in the project narrative form on grants.gov. So the same place you upload your organizational capacity statement is where you're going to upload your work plan file. It's important to use the template that CDC has created. So if you open, and there's the link to the particular template. I see Sarah's opening it up. Thank you, Sarah. The first page, and you'll see that there are multiple tabs. If you're not familiar with Excel, if you look down at the bottom of the screen, you'll see multiple tabs, right? The first tab is instructions, the second tab is cover sheet, the third tab is emergency ops, then health info tech, all right? The instructions is a pretty concise instruction and overview on what needs to be filled out in each one of the work plan tabs. The cover sheet, if you'll click on the cover sheet right now, Sarah. Recipient name, this will be the name of the tribe or tribal organization, performance year. You can simply put 2020. The mission date, you can put the current date or the date that's going to be submitted. It doesn't make much of a huge difference as long as it's not after May 31st. All of the remaining tabs speak to one of the 8 topical areas that Sarah mentioned in her overview. You do not need to do work or propose activities in all 8 areas. You can choose 1, 2, or 3, you know, or all 8. The option is up to you to identify the area of greatest need and the capacity that aligns with that need and create activities within that particular topical area. Within each, oh, thank you, Sarah, for going back. And here's an example. This is emergency operations. Within each of these work plan strategy areas, there are yellow squares. The yellow squares are the only squares that you need to complete. If a square is white, ignore it and leave it blank. Okay? So for example, you would need to put title. If you have this will be the title of your application, or if you actually have a specific title for that area of activity, feel free to write it in. Priority population, geographic area. The priority population, if this is going to be specific to, say, tribal leaders, elders, youth, that's where you would include that particular description there. Geographic area, if this is going to be reservation-wide or specific village, a specific community within your reservation, this is where you would include this. Or if you're applying as a tribal consortia or tribal organization, you would need to delineate just a little bit more on the geographic area that your projects are going to be reaching. Know that you have to complete this for each one of these activities. So your priority population and geographic area may differ depending on the activity that you're implementing. So for example, emergency operations may cover just the reservation, but your health information might cover people who live on the reservation as well as those who live in border communities and seek their health care on the reservation. Key deliverables and outputs. This is where you're actually going to talk about, at the end of the day, what's going to be produced by these activities. Is it going to be 5 new posters, 1 new public service announcement? Is it going to be a new patch for our health information technology? Is it going to be a new incident management system? Is it going to be a new incident management facility? Is it going to be training? So this is where you're actually going to talk about what's going to be the end result. What are you actually going to be producing that's going to be of benefit? I will say on the instructions, they provide some brief examples. Sarah, will you go back and click on the instructions tab? The CDC has provided some just brief examples of some outputs, such as disseminate 12 community messages that are accurate, timely, and reach the intended communities. Update quarantine procedures. So these key deliverables and outputs, thank you, Sarah, do not need to be long. They do not need to be lengthy. I suggest that if you can, include a number so that they can be quantifiable. So if you're going to hire 2 new staff, if you're going to produce a new brochure, 1 new brochure, or 2 new brochures, if you're going to hold 3 virtual community town hall meetings, if you can, try and attach a number to that output. Thank you, Sarah. Would you click back to the emergency ops tab? So once you
Apologize.
complete, yeah, I know Sarah's going to open that work plan template back up for us. Once you complete those elements at the top, the title, priority population, geographic area, and key deliverables or outputs, then you're going to move to the bottom, and that's where you're actually going to complete your work plan element. They've already numbered your activities for you. Don't worry about it. There are 10 up there. You don't need to do 10. If you only have 1 or 2 you're going to propose, then just fill out 1 or 2. If you have more, feel free to add additional lines and add the same content. So for each one, you need to talk about the setting in which the activity is going to take place. Is it going to be the health clinic? Is it going to be a community? You can be general here. You don't need to be specific. We're not looking for addresses. We're not looking for proper names. It literally can be community. It can be home-based. It can be online, right? We're just looking for, well, I would say, if I were applying, those are the kind of words that I would use. Now, the activity description, this is where you're actually going to describe what you want to do. Now, remember that this is an activity, so you're talking about the action that you're going to implement. If I were applying for this, I would start everything with tribe XY will create ... Tribe XY will implement ... Tribe XY will construct ... And I would begin every one of my activity descriptions with a strong verb statement about what is actually going to be done. There are a list of strong verbs on the Funding Opportunities TA page that I talked about earlier on that tip sheet for writing activities and outcomes. And so things like, what are you going to construct? What are you going to develop? What are you going to implement? What are you going to, who are you going to hire? You know, what are you going to roll out? What are you going to evaluate? What are you going to draft? All of those. So start with a strong statement of what you're actually going to do. Now, when I say a strong statement, I'm really talking about the verb and some descriptive language. Don't feel like you need to go in depth and write a whole paragraph on what you're going to be doing. The point is, and one of the reasons this turnaround is so quick and the CDC has structured this in such a way is that everybody understands right now the value of getting this money out to the community so the community has these resources that they can use. So my recommendation, and if I were applying for these funds, I would use general language as best I can. Tribe XY will stand up a brand new incident management facility, right? And Sarah's brought up some good action words that you can use when you're writing your activities descriptions. You know, discuss, focus, review, link, access, transform, identify, reinforce, validate. So thank you for sharing that, Sarah. And that's just a little quick one-page tip sheets on the NIHB Funding Opportunities website. So if you are going to construct a new facility, you know, or renovate an existing old non-federal facility, then you would simply do that. You would state that here. Tribe XY will renovate the old tribal Head Start trailer to serve as an incident management facility, or an old tribal preschool, you know, something like that, or some rooms within the tribal headquarters. Construction projects are allowed under this particular NOFO, as long as they are construction, alteration, or renovation of non-federally owned facilities. And of course, everything needs to be related to improving preparedness and response. So 1 sentence, 2 sentences there in our activity description. I suggest keeping it high level, keep it general. Also, if you are going to be seeking reimbursement for activities back, as Sarah mentioned, back to January, then you'll need to describe those activities as well. You don't need to talk about reimbursing it necessarily, but you simply need to state it in the present tense. If, you know, back in March you purchased PPE, right, then you will need to put Tribe XY will purchase, you know, PPE sufficient to sustain, you know, the health clinic's response and preparedness. Right? Even if that activity already took place, I would suggest state it in the present tense. But that's important that you include activities here somewhere in your work plan, even if you're going to be reimbursing them. Contributing partners, if you have any partners that you're going to tap into, partners can be non-tribal partners, it can be a county health department, it can be a tribal nonprofit, it can be an area Indian health board, it can be a tribal college, it can be a non-tribal college. It could also be consultants that you want to work with. I'm sorry, consultants are the next column. But so if there are partners within the tribe or external to the tribe or org that you're going to be partnering with, and they're going to be contributing in a significant way in this activity, just simply list them here. And all you have to do is name them. And then if you're going to be issuing any key contracts, or whether they be larger contracts or smaller consultant contracts, you're going to list those there as well. And then the start date and the end date. When you anticipate it starting, when you anticipate it ending, this is where you're going to note if something's already happened in the past. Okay. I suggest writing all your activities, just keep it consistent, write them all present tense, use the start and the end date to talk about when things have happened or when they will happen. All right. So what you will need to think about in advance is what strategy area or focus area your particular activities fall under. Is it emergency operations? Is it health information technology? Or any of the 8 that come down the road. If nothing seems like a good fit, it just doesn't make sense, put it under other. Just put it under 8, put it under other. All right. So there's lab capacity, surveillance and epidemiology, communications, countermeasures, recovery, and other. So within these 8, I feel like it's broad enough that almost all activities can be captured, and I think that was the intent. A reminder that when you're filling those out, you don't have to fill out, you don't have to create activities for all 8, and you only fill out what's yellow squares on each of those tabs. Okay. Next slide, Sarah. All right. So the project narrative, you do need to complete a full project narrative. And what you want to write for is your projected need, and this is important. All of the activities and the budget should align with what you project your need is. If the tribe thinks they need $800,000, then they're going to write activities, work plan, and budget narrative for $800,000. If they feel like what they need is $150,000, then that's what they're going to be writing towards, right? Regardless of the notice of awards and the provision of $25,000 immediately and more funds coming later, simply write up to the ceiling allowable, write what the tribe or tribal org actually needs. And I don't want to harp too much on that, because that's the message I want. I want people to think about what their needs are and identify activities and a budget to match it. That's what you should be applying for. So the CDC has a standard budget narrative form. You can find that online in a number of different Google places. But know that you'll need to construct a budget narrative that has all of these elements: salaries and wages, fringe benefits, consulting costs, equipment, supplies, travel, other, which is broad, contractual costs. This is where you're going to be issuing larger contracts, and then you'll be totaling your direct costs and your indirect costs. Next slide, sir. There are some other forms that you would need to upload in grants.gov. If you have an indirect cost rate, then you'll need to upload documentation of your indirect cost rate. If you do not have documentation for your indirect cost rate, still know that you can always claim a 10%, what they call a de minimis indirect cost rate. And you can write that into your budget and simply upload a letter that says, you're claiming a 10% de minimis indirect cost rate. But if you have a higher indirect cost rate or a federally negotiated indirect cost rate, then you'll upload your documentation under the budget form. If you are a nonprofit, and then upload your PDF of your nonprofit status, the proof that you have that you are a nonprofit. And you would upload that as an other budget document under the budget form on grants.gov. I should also say your budget narrative should be uploaded as a PDF. Okay, next slide, Sarah. I'm going to move kind of quickly through some of these required forms. Now, the project abstract form, this is an important form for a couple of reasons. This is where you're going to have a paragraph, write a paragraph about the project that you're implementing. I suggest naming the topical areas, the strategy areas out of those 8 that you're going to focus on and what you're hoping to achieve. I wouldn't drill too deep into your describing your actual activities. I would simply talk about how much you're applying for and the 8 topical areas that you're applying for and what you're hoping to achieve with the funding. At the bottom of this, and this is an online form, so you would write your abstract in Word, cut and paste it over, right? And here's the project abstract form. So there's where you would cut and paste your paragraph. And that square at the bottom, scroll back down, Sarah, is extremely important, and sometimes it's easily overlooked. Estimated number of people to be served. This is extremely important because this will also go into that funding calculation for the second notice of award. So you need to think about how many people this project is going to reach and it's going to serve. Now, I would err, if I were applying for this, I would err on the side of generous, right? If you're doing online work, how many people do you think is going to access your website? If you can do social media work, how many people are going to read your social media posts or reposts or tweets? If you're doing work within the clinic, what's your total catchment population for that entire clinic? Now, the IHS user population, you can include that, but just know that we're not asking, the CDC is not asking for IHS user population here. You just need to think about, with all this work that we're going to do, how many people are going to be impacted, how many people are going to be affected by this work that we are proposing to do, and enter that here, and that's an important block. So you can return to the PowerPoint. And next slide. Okay, the SF424A, this is where you're going to enter your budget information. So you've created your budget, you have your narrative. Now you just need to enter your budget category totals into your SF424A. There's some other information like contact information that it will ask for, and that's just kind of standard, but the most important piece is the budget information. Now this is, oh, I'm sorry, I was talking about the SF424A. The SF424 is really just contact information. But there is something you need to know, and here's the SF424A. It's going to talk about your contact information. You'll need to have your employee ID or tax number for the tribe or tribal org, and other things that are going to be really important. You need to create a title for your project, name of the federal agency, CDC. A lot of these forms on grants, a lot of the lines on grants.gov in this form will be pre-populated already. You only need to fill out online what's in yellow, okay? And a lot of these will be pre-populated based on other forms you've already filled out and populated by the CDC in advance. So you'll see that this is a very quick one that you need to complete. Scroll back up, right, Sarah, thank you, right there. You will need to know the congressional district in which the tribe is housed. If you're in multiple congressional districts, I would just suggest using the one where your tribal headquarters is housed. And that needs to be typed in the form of your state abbreviation, like MT for Montana dash, then 001 or 02, 03. That's the actual congressional district. So you may need to go online, do a quick search to find out what congressional district is housing your tribal headquarters. But that is an important piece because the grants.gov will not let you hit submit on this form without that information. Then your proposed project start and end date. And then here's where you put online A at 18A, and this is all you need to put, is the total amount of your request. What's the total amount? Is it 800,000, 900,000, is it 225,000? That's what you need there. This program is not on 19, check C, it's not covered by Executive Order 12-372. Hopefully the tribe or org is not delinquent on any federal debt, but you will need to check yes or no on that. Check I agree that everything submitted is accurate. Fill out your authorized representative. Everybody, every tribe or tribal organization has an authorized representative. and the other people who are authorized within grants.gov to sign your forms. And so you will need to know who that is if you're going to be filling this out yourself. And then you save this at the bottom. It'll tell you if save's been complete, and you can close out of it. And this form gets signed automatically when you hit submit on grants.gov. Right. Next slide, sir. SF424A is where you need to enter the total for each of your budget categories. So that's salary, wages, fringe benefits, consultant costs, equipment, supplies, travel, other, contractual. 1A, your grant, that will be pre-populated for you. So will 1B, your CFDA number. If it does ask for it, you can always find that information right in the actual NOFO. But if it's not pre-populated, then grant program function activity will be CDC RFA OT20-2004. So that's the RFA number. And the CFDA number for this particular NOFO is 93.391. Under budget summary, all you would need to write here is under E, federal, the total amount of your proposal. And that's all you need to enter on that line. Sarah, would you scroll down for me? Okay, 6, A, B, C, D, E, F, G, H, I, J, and K. This is where you are going to enter the totals for each of your budget categories, and it will add it up for you at 6K. And it's important that what you entered on page 1 under your 1E matches 6K. If it doesn't, it'll flag and won't let you advance. So the total of your budget categories needs to total your total request. And Sarah, you can scroll down. Okay, section C, if you, the tribe or tribe org, the state or other resources are going to be contributing to the activities you proposed, this is how much you're going to report here, how much money they're going to be bringing. I am going to make a strong suggestion to the tribes and tribal orgs applying to try and make this as simple as possible and try to keep your activities distinctly funded by your CDC funding. It will simplify this 100-fold. And if that is indeed the case, then you can put 0 for B, C, and D. And basically you're saying that we're not receiving any of the money to do the work we are proposing to do. Okay, under 13, this is, and grants.gov divides this out for you. Really what it does, it takes what you're totally proposing, divides it by 4, and says you need basically a quarter of that total amount to do the work for a quarter of the year. So if you ask for $1 million under 13, you'll see $250,000 appear in each one of those yellow squares. Okay, and then for future funding, this is saying we need this much money to continue this work in future years. And feel free to write 1 million for the first, second, third, and fourth consecutive years if you feel like you need additional funds. It's not a guarantee of additional funds, but it simply lets CDC know. And under section F, there's no requirement to fill anything in any of those squares. Okay, so let's return to the PowerPoint. I do want to say that the SF424A on grants.gov is a budget information for non-construction programs. Even if you are going to be proposing to do construction, just fill out the non-construction program because that's the only one that's available on grants.gov. Next slide. Assurances, certifications. I'm going to be very cut and dry on this. I suggest everybody goes to that link right there, and it will download a zip folder for you with 4 PDF files in it. I suggest printing out the assurances certification form and getting it signed, and printing out the assurances non-construction form and getting it signed. If you are proposing to do construction work or renovation work, and that's the actual folder that's going to be pop up on your screen as a download if you click that link. That is the CDC link. So these are the CDC forms. If you are going to be doing construction work, then download and have signed the insurances construction form. I just suggest everybody download the actual copies and get them signed and PDF them, scan them, and upload them in grants.gov on your own, just to make sure you're all covered. You might have already submitted this. CDC and HHS might already have it on file, But just make sure you're covered. Just print them and get them signed and get them uploaded. Next slide. Okay, the risk assessment questionnaire. There's the link to it. It is not a grants.gov form, so you do need to follow this link and complete the risk assessment questionnaire. The risk assessment questionnaire asks questions about your personnel, your staffing, accounting, and accounting capabilities. The CDC has stated if any tribe or tribal org or applicant is uncomfortable or unable to answer any questions, just skip them, just leave them blank. The CDC may come back later and ask for more information or clarification, but you can skip them. And it requires no signature, all right? And that's important to note as well. Yep, and there, thank you, Sarah, you can be doing that. This is the online form. You can fill this out online and then scroll to the bottom, Sarah. You can hit print right there. You can try and email it to yourself. You can try and save it. You know, different systems with different firewalls have different capabilities. So before you exit out, just make sure you've got this form answered in some way, shape, or form so you don't have to like try and revisit it and try and figure out it again. And some of these questions are in depth, such as what % of your organization's capital is from federal funding? That may not be information that's easy to get, especially at the tribal level. So if you're unable or don't know, then leave it blank. But you do need to submit some version of this risk assessment questionnaire in your application. I did see a question. I'm going to go ahead and answer this now. Can we include legal costs? Yes, you can. You can include legal costs and legal consultation with lawyers on incident management, emergency preparedness plans, anything of that nature, as long as it relates to your COVID-19 emergency response and preparedness. The answer is yes, you can include legal costs. Okay, so let's return to the PowerPoint. All right, disclosure of lobbying activities. This is a standard form that's required for any federal grant application. It is an online form. You complete it 100% in grants.gov. It is required. So even if you won't be doing lobbying as part of this proposal, which is not allowed anyway. So but even if you're not going to be doing any lobbying, you need to complete this form. If your tribe has a formal lobbyist, then you would enter their name under the element of the form that asks person conducting lobbying activities, right? But even if you don't have the lobbyist name, you do need to enter somebody's name here. Normally a project director, project manager, if somebody higher up, and maybe even the tribal chair if you have permission to do such. But it's right there, 10A, name and address of lobbying registrant. It should be said that entering a name here does not mean that you are saying this person is a registered lobbyist for the tribe. Okay, that's important. And I say that with a fair amount of confidence because I've submitted my name under there before as well. And all that's required is the first and last name. But you do need to put somebody's name in 10A and 10B. But again, if the tribe is a registered lobbyist, then I suggest putting their name there, even if they're not going to be working on any piece of this project. And then it does need to be signed by the authorized representative again. All right, next slide. All right, HHS checklist. This is their online checklist. This is not specific to this RFA or this NOFO. This is a standard checklist. So you do need to go down and checklist and check the boxes of the things that you have done. Thank you, Sarah, for bringing this form up. So who's the business official that's to be contacted? So this is normally it's a finance contact or somebody from the grants management office. You only need to fill in what's in yellow again. Sarah, keep scrolling down. And then your project director who's going to do this. This next part D is asking if you're a nonprofit, if you provided evidence of your nonprofit status. There's information on the Executive Order 12372, which does not cover this NOFO. And then it's asking if you've submitted assurances and certifications.
Hey, Robert, you're muted.
if you're unsure if you've submitted all the necessary assurances and certifications in addition to the PDFs you've hopefully uploaded, then, and I've done this just to cover myself, you can download and have signed the ones that are listed there. And I have done that, and they are actually available in a single form these days. So if you just want to make sure you're covered, then you can access that single form, get it signed and get it uploaded. And I've done that before just to make sure. But if you've applied before for federal grants, then chances are then HHS already has that on file for you. So we are now approaching our question and answer period. And I thank everybody for sticking with me as we did that walkthrough. And I am going to defer to my colleagues who I know have been monitoring the chat box to get me those questions that have already come through. And I hope everybody excuses me while I take a drink of water.
Excellent. Thank you for everybody who submitted questions. Right now we have about 8 in the queue. And Robert, I've sent some of these through to you. The first one that we have is from Elizabeth Ellis on understanding if the funds can be used that were not used from other grant funding. And please, Ms. Ellis, if there is clarification about that or you want to explain it yourself, please go ahead and unmute yourself. The floor is yours.
Hi, this is Elizabeth.
Okay, great.
I was just, clarifying the reimbursement from previous costs, and just clarifying that wouldn't be those costs would not be reimbursable if they had been funded from other funding agencies. So being careful of that. It's very high-end financial management right now to ensure that that doesn't happen, because it can't be reimbursed for something that was awarded. That's one way of thinking about it. So I just wanted to bring that up, and also as a reminder to myself.
That's a wonderful point. Thank you so much. So if the tribe has expended money of its own that has not already been reimbursed or was not supported by other federal, especially federal funding sources, but it could be state. Basically, if the tribe has expended or the organization has expended money out of their own savings account, so to speak, then they can submit to have those reimbursed. But you're absolutely right. If the money is already being reimbursed, or if it was already supported through another funding stream and paid for, it cannot be reimbursed in this through this NOFO. Thank you so much, Elizabeth.
The next question that we have, we had 2 from Stephanie Denning. I'm trying to go in order that they were received, but also just condensing them for one person. So the first question was, can one entity apply through grants.gov on behalf of another, or does the applicant organization have to do the actual uploading?
Well, the uploading can be done by anybody, but it is all a matter of whose grants.gov account, right? That's happening under. So the applicant must be the owner of that grants.gov account, right? Because it's that submission, it's that account that actually establishes who the actual applicant is. Now, any individual can assist with the uploading process. And so it's the best of my understanding, one entity cannot be applying on behalf of another entity. And that really goes to eligibility, because the applicant is the recipient of the actual notice of award. And so, and I want to touch on this because I know somebody actually had a question about this. Eligibility for this particular NOFO is restricted to, and this is right in the NOFO, and I'm going to read from page 13 of the NOFO. Indian tribes, as defined, we'll just say by federal law, 25 U.S.C. 1603. So any Indian tribe, band, nation, or other organized group or community, including Alaska Native villages or group or regional or village corporation as established by the Alaska Native Claims Settlement Act. So which is recognized as eligible for the special programs and services provided by the United States to Indians because of their status as Indians. Somebody had a question about state recognized tribes, and I reading this eligibility, would say that a state recognized tribe is not eligible, even to apply as a nonprofit. So I hope that answered that question. I hope that answered a couple of questions.
The next question that we also had from Stephanie was regarding the HHS 5161 checklist, Part B, number 1. That reads, has a public health system impact statement for the proposed program or project been completed and distributed as required? So she was asking about some guidance on what is required to meet that statement.
I'm actually going to open up my grants.gov account because I created a workspace for this NOFO so that I can move through it as well. So give me 1 second because I just want to make sure that I'm going to make an accurate suggestion. All right, so I apologize while I go into my grants.gov. And I want to be sure that I'm going to the right form. This is I would suggest to check. I'm checking not applicable. If I were applying for this, I would check not applicable. And the NOFO does not mention any requirement of a public health impact statement. Yeah. So I see exactly what question you're asking on the form. So I would check not applicable.
Great. The next question was somebody asking, where do we upload the work plan file?
The work plan file, both required documents, the Excel work plan and organizational capacity, will be uploaded in grants.gov under the project narrative form.
There was a question, Robert, a clarification going back to the other question about the HHS 5161 form. If you were able to just show where to click not applicable and what particular item of that form people were, we were discussing.
Yes, I'm actually going to share my screen. Thank you, Sarah. So give just a second. I'm going to share my screen so everybody can see exactly where I am. Okay, so this is the 5161 form, and this is an online form, so you can simply check whatever you need to check. In this case, the type of application would be new. And if you scroll down, the specific question is Part B, and this is the public health impact statement question that was being referred to. And I would click not applicable. Okay.
The next question that we had was from Julia Russ. The minimum funding is $25,000. Will that amount be available for each tribe to create accurate budgets?
Yes. Yeah, that minimum amount of $25,000 is will be awarded to every single applicant. And so you can consider that your floor award amount for budgeting purposes. And I will say for planning purposes, the CDC has been getting that dollar amount out to people in their first notice of award within 10 days. So if there are things that need to be made available immediately, know that you'll have $25,000 hopefully within 10 days available.
We had a few questions about funds related to construction and infrastructure. So can architectural expenses be requested when they're being incurred to provide for remodeling for the purposes, for example, of a COVID-19 testing center at a clinic?
If I were applying for this and we had that need, as my interpretation would be yes. Yes, as long as it's not a federal facility. That guidance has been provided by CDC to us that all construction and construction-related expenses cannot be on a federal facility. So it must be a non-federal facility, such as a tribal clinic, or if it's a new testing facility that the tribe is wishing to construct or renovate, then yes, I would say those architectural expenses would be included. Next question.
Oh, sorry, Robert, I was on mute. And costs for implementing telework policies or changing the tribal workplace allow for social distancing. Would that be eligible for this grant?
If I were applying, I would say yes. Yes, I would write for those expenses. Again, if it's within a non-federal facility.
There were a couple questions about applying for this grant and having applied for other forms of funding. So, for example, if a tribe has applied for CARES Act and received CARES Act funds or materials, can they ask for items that were not included in that? And should you mention items that were purchased from different funds if you're requesting supplemental items from this particular funding mechanism? For example, personal protective equipment.
You can definitely purchase things under this funding opportunity announcement that were not covered in previous CARES allocations or funding. And I think kind of that's the bottom line. If you are not able to purchase anything or cover any previous expenses, then yes, you can write for that in your work plan here, in your budget here. There should not be any need to disclose what has already been purchased or what's already been covered, as long as you're not duplicating anything. So I would not bother with that element.
Okay, and so the second question is, are tribes required to list CARES Act funds in the notice for request as other funds?
No.
Okay. Great. The next question that we had was the financial information form. Should that be filled out for the entire tribe or for its Title I contract operation financial office?
Oh, that's a really good question. If I were applying, I would say for the entire tribe. Now, I will add a caveat to that. If, particularly for some of the larger tribes, if it's a particular department or operation that undergoes a separate audit, then I would say you could complete the risk assessment questionnaire based upon that particular department. But really, I would ask who is audited. Is the tribe audited as a whole, or is the hospital audited, or is the clinic audited, or is that particular department audited? And then that's what I would complete the questionnaire based upon.
A question in a similar vein was, if we don't have all the paperwork necessary currently to withstand an audit, for example, retroactive salary costs, assuming we shouldn't include that in the grant, but does this preclude us from submitting for retroactive salary costs later?
Nina, will you repeat that question?
Yeah, and this is from Linda Santee. If you want to also clarify as well, please go ahead and unmute yourself. The original question is, if we don't have all the paperwork necessary currently to withstand audit, for example, retroactive salary costs, we assume we shouldn't include that. But does this preclude us for submitting retroactive salary costs later?
This is Linda Santee. I've unmuted.
Okay,
so,
thank you.
Thank you. This has been very helpful already. We've created time cards, if you will, where people are writing their very specific COVID-related times. We're trying to track that. We know that we, at this point, don't really have the capacity for everyone to individually go back and build that from January 20th on. So particularly for February, for example, we've just known when we have group meetings and who was at the meetings according to sign-in sheets, and at least, those 20 hours can be captured. Mm-hmm. However, we assume we're going to be able to, we'll find more of these the expenditures that we've gone through. So the the question, specifically using that example, is if we only put in what ends up being 20% of the actual time that's been COVID related in our request on this, does that for any reason preclude us from, once we recognize what our true costs are, going back and saying, whoops, we said we had 100,000 and it turns out we have 400,000.
Okay, so Linda, I completely understand your question now. And again, I'm going to speak as if I was writing our grant proposal for this. I would say that I don't think it does preclude you. And this is why I say that. CDC has already told us that they're issuing notices of award. Regardless of what is written into the budget narrative, they're releasing notices of award with the full lump sum dollar amount in the other budget category to provide maximum amount of flexibility in spending. And also in other discussions I've had with CDC, we, for example, if we were to go back and ask for reimbursable costs back in February, then we have been asked to write a letter to CDC saying, these are the costs that we incurred during this time, and we would like to use our funds to do that. So that tells me that the CDC is, again, being very, very flexible in this regard. So if you've identified 20%, later on you think it's more like it's closer to 30 or 40, then I do not think that you will be precluded from asking for that full reimbursement amount at a later date. Now, I would also consult with your auditors and make sure, when we talk about high financial structuring, to make sure that time is allocated properly and things get billed to the right place, even if you can do it retroactively and change existing documentation. But Linda, it sounds like you're probably on top of that and know who you need to talk to make that happen. But to answer your question, I don't think it would preclude going back later and amending reimbursement costs.
Thank you.
A question in a similar vein was, how do we apply for reimbursement for funds used for COVID so far through this grant mechanism? This is from Terry McHale.
I would not necessarily highlight anything really as a reimbursable expense. I mean, you have to write a budget for the full amount. You have to write a work plan for all the things you're going to do. There's no place for you to actually sit down and write a narrative or get further in depth on what's reimbursable, what's not reimbursable. The only place that's really could potentially be captured is in the start and end date in your work plan. So if I were writing this and I want to talk about some of our initial ramp-up activities back in February, or some of the initial communications we did, or the new web pages we constructed in early March, I would simply write that as an activity. Tribe XY will construct a COVID-19 response page, ... And the start date for that activity, I would list as February 15th. The end date, I would list as whenever that ended. Or if it's ongoing, then, a future end date. And then I would write that into the actual budget narrative, no differently. And then after awarding has been made, then work with your project officer on if they would require additional documentation for the reimbursable expenses. But I would not apply for expenses that are reimbursable, current or future, any differently under this NOFO.
The next question was from Arlene Mack, asking, am I understanding correctly that each federally recognized tribe should submit a budget for 100% of need regardless of actual funding limits?
Yes. Yes. And that serves a couple of different purposes. One, it's definitely going to highlight your need and potentially allow you to receive funding to meet that need. And I think I threw out numbers like $1 million and 800,000. Those are expensive, right? And the average award, as noted in the NOFO, will be around $70,000. But submit based upon your need because two reasons. there is a strong potential for future funding, and applying and getting things documented in the system eases the process to award money for future funding. So apply for actual need, right? I should say 2, we also heard in the CDC call last week to apply for actual need. And then 3, 70,000 is the actual award, but nobody really knows yet. Nobody knows how much is going to be awarded in that second notice of award, because it's going to be based on the population served, and ultimately it's also going to be based on the number of applicants that the CDC receives. So do create a work plan and a budget based on your actual need. If the amount awarded varies, then like any other grant award, you probably have to work with the CDC to make some amendments.
There are 2 somewhat related questions from Carolyn Crowder, and this is a 2-part question. The first is, if our total need is, for example, $1 million, and we know that we will only get at least a minimum of $25,000, when will we know if we get the higher amounts?
The second NOFO, and Sarah, remind me if you know the dates off the top of your head. The second NOFO, so you receive your first notice of award, they say within 10 days. That's the 25,000. The second notice of award will be coming through, and that will notify you of your full funding amount. Sarah, do you know the dates for the second notice of award?
I don't have an exact date, but it will be sometime in June.
Okay, in June, okay.
And then,
and hi, Carolyn. It's good to hear your cyber voice, by the way.
the second question too was, should we apply for funds beyond that $25,000 initially in the event we don't receive funding in that second batch? And what happens if we do get multiple sources of funding for the same activities?
Should you apply for more than $25,000? My guidance, my suggestion is yes, you should apply for actual need. And then you'll have to amend based upon your actual award. It could be more than you asked for, it could be less. But definitely apply for more than just that $25,000 if that aligns with your need. I guess there's my qualifier. Nina, will you read that second part of the question again?
Yeah, the second part was, what happens if you get multiple sources of funding for the same activities because you applied for multiple grants? You know, what do you do in that case? Do you refuse some of the money? What do you need to do to remain in compliance?
Okay. As a nonprofit employee, I would never refuse money, right? Right now, we need to get funds out to the tribes. Tribes have needs, right? So I wouldn't refuse any of the money. If you did actually apply for the same activity from different funding sources and you did get awarded that, then in order to make sure you remain compliant and you don't double dip, right? Pay for the same activity with the same amount of funds, you need to contact your project officer immediately and have a discussion with them about amending elements of that work plan and making sure that your financial system, that you have a financial system in place to accurately account for what expenses are going to go to what project. The point being is you need to keep them distinct. You do need to keep them distinct. That's not to say you can't use funds from 2 different sources for the same task, like website construction, but how can you keep them distinct so that they satisfy the distinct activities within each work plan? So for example, is one web page going to be focused solely on these and another web page be focused solely on these? And the invoice we receive from our webmaster will delineate the work on each and will pay each invoice out of each. And that's just an example. But if you did receive multiple funding sources for the same activity, you do need to come back around and figure out how to separate those out to avoid double dipping. Because the last thing we need is any kind of, non-compliance to come out of this, and we don't want any tribes to get in trouble. And you potentially could, because this is violating that is actually higher than the CDC. Then we're really talking about federal funding guidelines.
The next question we have is from Shauna Hotch about allowable uses of the funds for this grant. Would elder food distribution programs count as COVID-19 mitigation?
I would say yes. Now, I know the purchasing of food is controversial, but if I were applying for it, if that's the need I hear from my community and it's a great need, I would write that activity in, absolutely. And then if the CDC is going to require any further documentation or would like to talk to you about that after the fact, then I would entertain that and provide them anything they would need after the fact. But I would write that into a work plan, absolutely.
And then a second question was, would this grant be able to fund a scholarship for a Master's of Public Health student internship?
Well, here it is. Now I am stumped. That I don't know. That I don't know. If it's covering a matter of personnel costs or consulting costs to bring somebody with some level of subject matter expertise to your project, whether that be a student, graduated or not, I would think that that would be allowable. So as I'm talking this through, this would be my suggestion. Again, not a CDC employee or representative, just giving some TA, some suggestions. I wouldn't write it in as a scholarship. I wouldn't even write it in as an internship. If there's a student that, or a person, student or not student, that you think would be a benefit to the project, then write them in as a salary or consulting cost. But I would not call it a scholarship. That would be my guidance.
We have a few more questions. The next one is from Kim Rogers. Are we to do any prioritization of our requested areas or items, or is it all equal?
Repeat the question, Nina, because I want to make sure that I'm understanding. When they say suggested areas, are they talking about those 8 topical areas for the work plan? So will you repeat the question once?
Yeah, and Kim, feel free to jump on too if you want to clarify. Are we to do any prioritization of our requested areas or items, or is it all equal?
Okay. In the applicant materials, I haven't noted a place for prioritization. And so I would think any prioritization would be just based upon what those needs are and how you would budget for them. Now, knowing that the actual amount to be received is variable, then I would be kind of savvy to focus on the highest needs and the highest priorities within my application. But also know that, again, the funding is going to come in one lump sum amount. So even if you get less, then you can look at your work plan and say, okay, we need to use the $80,000 we got on this activity. We're not able to do that activity. So I wouldn't necessarily note any prioritization in my application, but as a tribal team, as a public health team, in your head, I would have those priorities in line so that you can hit the ground running and use the money the way you need to, whatever amount comes through. I hope that made sense.
A related question from Justin Williams was, if the award amount is lower than the requested amount, will we know what line item activities were not allowed or funded?
I also am not 100% sure, right? Because I'm not sure if technical reviews are going to be issued for all of these notice of awards. So I would say that would be a question for your project officer or technical monitor after the fact. But notice that there will be notice of awards. And so there will probably be some elements in your notice of award, excuse me, around, normally they fall around page 4, 5, or 6 that talk about necessary revisions or things that were disallowed or areas of concern by the reviewers. And so that would be the first place I would look. Then the second place, you would have to just ask your project officer based on the specific review that was conducted.
The next question that we have is from Carol Justice. How is the IHS fractionated interest decided, and when will we know what that amount is as a Title I tribal contractor?
Mm-hmm. So the fractionated allotment amount, that was the formula developed by IHS, as I understand it. And although it's not been explicitly said, I imagine it's probably something closely akin to tribal shares, but don't quote me on that. Again, not an IHS employee. That's just how I would have interpreted it. Now, the fractionated allotment amount, correct me if I'm wrong, Sarah, but that's going to come out in your Notice of Award 1. So the first Notice of Award that includes your $25,000 will also include the fractionated amount. Is that correct, Sarah?
If you're a component A, yes. And if you're component B, you won't be getting the fractionated amount.
Mm-hmm. So you should know within 10 days the amount of that fractionated amount. 10 days of applying, I should say. And again, that's for component A.
The last question that we have right now is from Dan Clarion. Can our tribe purchase from the city to stage our COVID medical supply?
Yes. Yeah, I would say, you know, as long as we're on the list of, you know, approved federal vendors, which I would imagine the city and state are, then yeah, I would say you could purchase medical supplies from the city and state.
Those are all the questions we have on the list. Unless there is somebody that we didn't cover or the content we didn't cover, please let us know right now. Oh, there is one last question that just came in. Will IDC simply be a calculation?
Yeah, IDC will be a calculation, a percentage applied to your total direct cost at the end. Yeah. So in this case, since the amount of the total budget is variable, you know, I would just write the budget for our needs and total up all my direct costs and then apply my indirect costs to that.
Oh. Sorry, Dan, I misunderstood your question. The question is, can we purchase a lot from the city to stage medical supply connexes? So interpreting this as like a physical parcel of land.
Oh, purchasing land. I would say that's also probably a pretty dicey one. I would not, and again, just offering some TA, I would not advise on writing in a purchase of land for what is going to amount to probably a temporary activity. Now, rent, I would say that's definitely an allowable expense, but I'm not sure that the purchase of land or a lot would be. So my advice would be to not write that in.
Okay, I think that's all the questions that we have. Liz Walker had a question about consultants, which we're trying to answer. And then there's another question from Kim. Are we supposed to be writing for the component A sum, or is that an add-on?
So you're not going to know the component A sum. So nobody here on the phone, nobody applying for this is actually going to know their final amount, unless they're just applying for 25, I'd say, because you should be applying for whatever your identified need is. And so there's no add-on. If you're applying under component A, because you are component A, you submit one application, that's it, under component A. And so, and as far as the sum, what you're going to write for, even if you're component A or B, is going to be what your identified need is, you know, based on the activities you want to do. I hope that made sense, Kim.
We have a question from Liz Walker. Can tribes write in consultant costs into the grant?
Yes, yes, absolutely.
Great. And I think, Naomi, that should answer your question about including the cost of a consultant to help write and compile the grant application materials.
Oh, now if you're going to be writing a grant writer, as a consultant, this would be my advice on that. That's normally that's not allowable if to write the cost of the person who prepared your grant proposal into your actual grant budget. So that's not normally an allowable cost. Now, to provide some gentle advice, if you have somebody that's helping you construct your grant proposal, they should actually know that their costs are generally not allowable. So if it were me, I would engage that grant writer on how they can be involved in the implementation of the activities. And sometimes that's like around reporting or evaluating activities. And my experience has been, and my experience also has been as a contract grant writer, that grant writers are open to that, but they, yeah, unfortunately, you can't write the consultant costs for a grant preparer.
Okay, thank you. Are there any other questions at this moment that we can answer while we're all online together?
Can you hear me? I, for some reason, can't type in.
Yes, I can hear you.
I had a question about the contracting side. We have several remote native health clinics in our region here in Alaska. And we're trying to make an effort to add negative pressure rooms to these clinics. Would that be an allowable cost? That's the negative pressures to supply air to the room and exhaust it through a HEPA filter to the outside.
Yeah, yeah. Are they tribally owned facilities or
Yes.
health corporations? Then
yeah, they're tribally owned buildings that are leased by the native nonprofit that supplies trust health services to the native people of Alaska.
Then it sounds to me like that would be an allowable cost.
Okay, thank you.
Robert, there was a clarification to consultant costs for grant writing. Would grant writers who are writing for COVID activities, those are not part of this application? Is that correct?
Will you repeat that one more time, Nina?
Whether you can include consultant costs for grant writing for COVID activities that are outside of the scope of this application.
No, you can't include those either. Development activities are not allowable costs. So whether it's this grant application or other grant applications, yeah, you should not include consulting costs for grant preparers.
Hello, are you taking questions from callers?
Yes.
Yeah.
You're just
Could we use the money to safely reopen tribal businesses such as casinos? So to set up for social distancing and testing and thermometers?
Just those three examples that you mentioned, I would think so, yes.
Okay. Okay, thank you.
Is there anyone else on the phone who has a question?
Hi,
Hello.
I'd like to follow up on that other question regarding consultants. Part of the consultant is helping us adjust some protocols for other programs that are needed for grants, like teleworking, because we never had teleworking before.
That, I would imagine, would be an allowable cost.
Even though they're grant writers?
Well, they're preparing protocols for telework, correct?
Yes, yes,
Yeah.
yes.
So it's really the activity the consultant will be working on. So if that consultant's going to help you construct policies, standard operating procedures and protocols for telework, and we're teleworking as a direct result of COVID, so that's part of our COVID response, I would think that consultant activity would be allowable.
Thank you.
Is there anyone else on the phone who has a question?
Yeah, I put something in the chat box, but it's kind of turned into gibberish. So maybe I'll just stay. That's okay. So We have assumed operations of an IHS building, which is still an IHS owned building. We have assumed operations for everything in that building. If there's modifications required, either through signage or screening stations, etc., can we include those building modifications necessary for the COVID activities?
Well, I did see your question in there, and I completely understand. Again, I'm going to provide some advice. If I were applying for this grant, I would write for those activities. I would write to include them, those building modifications, absolutely. And then if there are issues on the other end, they can be worked out. But if that's the need and that's what's been identified, then I would move forward with that. I know the issue of, the topic of federal versus non-federally owned buildings. That is very different in the country than it is with other communities. And so I would write for it because you own all the operations within that facility. And so in order to accurately and efficiently and safely operate a COVID response, you need to make those modifications. So I would write for them, and that would be my suggestion.
Could you hear me?
Yes.
I have a follow-up on that for building renovations. If the average amount is $70,000 a year, and the building that we would like to acquire is way more than that, is that still just put it in the proposal?
I would not suggest it sounds like this is akin to the question about buying land.
No. We want to help our college kids and our youth on distance learning, because some of our college kids are not going back to school, but we need an actual place for them to be located. Besides teleworking out of their homes, we wanted a distance learning place, like our Boys and Girls Club, to actually update that, renovate that building for distance learning, especially for our kids that have no computers at home.
Oh, I see. Well, I think this would be just a suggestion. If that's the identified need, write for it. And see what happens. And that's kind of where we are at this point. I don't know, and literally I'm trying to own my own ignorance. I don't know if the CDC would fund that activity, or because that response is supposed to be a public health response and public health infrastructure. And so I don't know if they would connect education and public health like some of us do. So I don't even know if they would fund that. So I'm just gonna be honest. But if that's the need, then I would certainly write for it. And I think that's probably the best, advice I could offer at this point.
Thank you.
We have one. Go ahead.
Thank you so much. I was confused by the answer regarding eligibility of Native American nonprofit organizations that are not affiliated with a federally recognized tribe.
My interpretation of the NOFA was that they are not eligible. And I think, Carl, I saw your question in the chat box, and so I was sure we got to it. But no, this application is just for federally recognized tribes or tribal health consortia. So oftentimes those tribal health consortia operate as nonprofits. So, for example, National Indian Health Board. We are a national tribal organization. We're a nonprofit, but we're not linked to a specific tribe. So we are not eligible to apply for this NOFA.
Thank you for the clarification.
Mm-hmm.
Those are all the questions that we had in the chat box for now.
Okay. Sarah, will you go ahead and, oh, there it is, great. So we know that this webinar has gone on longer than we'd all planned, but hopefully people found it valuable. My email address is on the screen, and I'm offering any advice that I can to any tribe or tribal org that's applying for this particular NOFO. And again, not a CDC employee, not an IHS employee. Really, we are just trying to provide this service to make sure that these resources that have been congressionally allocated, right? This is a result of some of the COVID relief packages, get out to the tribes where they're needed. And so that's an effort that we want to support in any way, shape that we can. So my email address is rfoley@nihb.org. And please feel free to email me any other questions maybe you didn't get to ask today, or anything that comes up in the next couple of weeks. Again, I'd like to mention that on May 26th, from 3 to 4:30, we will be holding kind of an open office hours, which will probably not be dissimilar than our question and answer period today. Just a chance for people to ask some last minute questions about work plans, submissions, forms, anything of that nature. So we'll be sending out more announcements as the date nears for that. So next slide, Sarah. There's a link to the actual NOFO on grants.gov. NIHB has some of our technical assistance materials up there. If you have a question regarding NIHB's COVID-19 response in general, anything that we're doing, please feel free to contact Courtney Wheeler at cwheeler@nihb.org. If you have any questions regarding this NOFO, please feel free to contact me directly at rfoley@nihb.org. Thank you, everybody. And thank you, everybody, for applying. We need these funds. We need this. We need these resources so tribal communities can mount their own responses and deal with their own local needs. So I certainly bow my head and am humbled by the work that everybody's doing locally. Thank you for your time, and be well. And with that, we will end the webinar.